Okay, it's time to start healthcare session 2. My name is YoungSung Lee from South Korea, Chungbuk National University. I am now in the venue, Taiwan Nantou, China University. Okay, today's topic is e-health for disability. First of all, I'd like to check each side connectivity. I would like to call your side and your name. Please raise your hand just for the sign of your connectivity. And from right side, David Watley from UK. Can you hear me? Okay, thank you. We can see you well. And Dr. Sung Ho, can you hear me? Please raise your hand. Okay. If you raise your hand, please front of your camera. So at this time, we can, okay, thank you, like that. And Seoul National University Hospital, Bundang University, okay, thank you. And here, Professor La, okay. And Nakashima from Kyushu University Hospital, okay, thank you. And Simon Stevens from UK, okay, thank you. And Professor Jong-hyuk Park from Chungbuk National University, okay, thank you. And here, venue side, okay, thank you very much. As you know, until last evening, Dr. Watley from the UK had connection difficulties. However, his commitment to this session and collaboration of involved Korean and Japanese staff members overcame consecutive failures and solved the problem finally. I would like to express my thanks to them who participated in those tests, and especially Dr. Watley. His active participation in tests, despite early local times over there, has enabled this session now. The topic of this session is the synergetic effect of ICT. ICT stands for Information Communication Technology in solving the difficulties of people with disabilities. Healthcare Session 2 has persistently explored how we can collaborate in solving healthcare issues by adopting new information technologies. Now let's listen to our speakers according to the program. First speakers would Naoki Nakashima from Kyushu University. He is the director, professor of the Medical Information Center of Kyushu University Hospital, and also a visiting professor of National Institute of Informatics, Japan. He has been a specialist of diabetes mellitus for 25 years and simultaneously worked as a specialist of medical informatics for 13 years. He is a council member of the Japanese Society of Diabetes Mellitus and the vice president of Japan Association for Medical Informatics. He focuses on disease management methodology of chronic disease from primary to tertiary prevention with sensor networking technology. He is also founding member or vice director of Telemedicine Development Center of Asia in Kyushu University. Short term is TAMDEC. TAMDEC is the most active institute for international telemedicine in Asia Pacific area. He is recently conducting cost-effective health checkup by sensor network and telemedicine with Grameen Group in Bangladesh. Grameen Group in Bangladesh will talk more about directly from Kyushu Nakashima. Okay, he is going to talk about the e-healthcare for disability in Japan. Dr. Nakashima, please go ahead.
Okay, thank you very much, Professor Lee. And my name is Naoki Nakashima. And maybe it's the newest agenda.
Excuse me, Dr. Sung Ho, please stop your sharing because we need to share our slides. if you don't stop the sharing, we cannot share our slide. Miss Sung Hee-ho, can you stop your slide?
Okay, we can see the slide. Please go ahead, Nakashima.
Okay.
Healthcare for disabilities.
Yeah, according to the newest agenda, my topic is different from this slide. So I changed the slide name. So my slide name is e-healthcare for disabilities.
Okay.
Okay. And first, I want to definition about the disabilities. We have four of the disabilities. One is physical disabilities, as for example, after effect of stroke or leg amputation by diabetes mellitus. And second disability is visual impairment, as blindness. And the third is speech disorder. And fourth is loss of hearing. This is, I think, disabilities group. This is Japanese population and aging ratio, past and future. This red line is right now. And Japan is the first runner of the aging society. And right now, the aging rate, that means population rate over the 65 years old, achieved already 65%, 1/4 of Japanese population. This is the toughest, highest rate in the world. And, it's will increase up to 40% in the 2060. This is actually maybe this time it's really difficult. It's going to be really difficult to support this society without any innovation. This means we should have more disabilities and dementias in future Japan. And also many world countries following us. Okay? And in this presentation, I would like to focus on disabilities, not on dementias. This is maybe next topics, I think. And this slide shows the target of this actually healthcare, e-healthcare system. Maybe main target is physical disability and visual impairment, because a person with loss of hearing and speech disorder can use almost all ordinary devices. And many of disabilities are often able to use ordinary healthcare devices without any effort. So, but in this presentation, I want to show additional or optional devices service for especially disabilities. Okay? And I want to make a definition of the health stage on these topics. Stage 1 is the health maintenance stage for healthy people. And stage 2 is prevention of NCD. NCD means chronic diseases for the little risky peoples. And the third stage is management of NCD, non-communicable diseases, for the affected people. Okay, stage 1 to stage 3 is in our focus. And I tried to make a classification of e-healthcare for disabilities. I arranged A, B, C, D, E. A is appropriate exercise, and B is balanced food, diet. and C is clinic visit. Actually, many people ignore to visit clinic, even they affected the chronic diseases. And D is daily support at home for the especially specific diseases, taking pills, rehabilitations, so on. And E is EICU at home. That means, for example, the person who affected by influenza virus, flu, or the person with severe diarrhea, they have to check their body and decide if they go to the clinic or not. Okay. And this is the first example. This is blood pressure monitor from A and D. This provides vocally explain how to use and announce check results. This is good for the person with visual impairment. And for stage 2 and stage 3 is DE. DE means daily support at home and EICU at home. You know, for example, with severe diarrhea, we have to check the dehydration. This weight scale contributes to know that the degree of dehydration. Okay, and this is electronic thermometers from Omo Healthcare. This is $120. This also provides vocally explain how to use and announce check results. Okay? And this is for stage 1 to 3, all of the stage, and good for visual impairment, and especially E. E is EIC at home. And this is weight scale named Inner Scan Voice from Tanita, Japanese company. This costs $150 US dollars. This is also the same function. Vocally explain how to use and announce check results. And I think this is good for stage 1 to 3, or stage 8 for visual impairment, and the case B and E. B is balanced food, and E is, I'm sorry, this is E, I see at home. And this is the package, attached case package we brought in the Bangladesh countryside to make the big scale health checkup and telemedicine in the countryside of Bangladesh. At this time, we just brought regular sensors, but we can easily replace this sensor to the sensor I just explained with the function for disabilities. And this slide explains about the function, the conversion function from letter information to voice information. We already have many applications in this, actually in Japan, in world. And this is good for support for daily life and good for healthcare education. For example, this is to speak by Toshiba. Maybe you can hear this voice.
Hello, my name is Jane. I speak American English. Hello, my name is Jane.
This is artificial voice by machine, from letter actually. This is American voice. And this is English voice.
Hello, my name is Charlotte. I speak British English. Hello, my name.
And this is from So this is Chinese language. Oops, what? Wrong. Oops. Right.
你好，我是小直，欢迎您体验东芝的中文语音合成技术。
These are very natural, and this is good for stage 1 or stage 1 to 3 and visual impairment and speech disorder. And the case with ABCDE, all cases. And maybe you may know Google Translate. For example, just I want to try. Oh, 답변하세요.
I did not sleep well. The wind was so strong yesterday.
Everybody can use this Google Translate function, right?
Nakashima-san, we cannot hear you.
Okay, sorry. Oh, I'm sorry.
Okay.
Maybe from here. I'm sorry. I want to introduce you about the remote sign language support. Maybe many of the world company already have this service, but Plus Voice Corporation is a Japanese company that they have two patterns of the service. One is face-to-face meeting with disabilities, and another is a meeting with remote place for the disabilities person. Okay. Sign language is as this. Okay. And this is also from same company, handwriting telephone for speech disorder and loss of hearing person with tablet PC. Okay. And this is a very new and very kind of innovative product, a kind of pilot study, I think. Almighty device for visual impairment or other, for example, speech disorders. This is just put with glasses, okay, from Israel company, Orkan. This device has camera, and for example, this lady cannot see the signal, but this camera recognizes the signal and notice this is red or green. Okay, and this is good for visual impairment, and also good for speech disorder person, because they don't actually okay, so and good for healthcare education for all stage disease and all cases, ABCDE. Okay, and also this is from Google contact lens with camera. They provide the news on this beginning of this year, and this contact lens has camera, and in the future this contact lens can assay the glucose level by tear fluid for diabetes patients. This is really amazing innovation, I think. This is good for stage 1 to 3 and for the visual impairment and all of the case, A, B, C, D, E. Okay, this is summary. We have some application of healthcare for disabilities, and disabilities are often able to use ordinary healthcare devices. So they can use many devices already. But in this study, I tried to make classification of e-healthcare application for disabilities, and IT supports tremendous advance of healthcare for disabilities. And if you have, that's all. And if you have any question, contact this mail address. Thank you very much for your attention.
Okay, thank you, Nakashima, Dr. Nakashima. Okay, so are there any questions? If you have any question, please raise your hand in front of camera so I can figure it out. So, Dr. Nakashima, I have questions. You talked about the visual impairment. So, does the glass commercially available or just a research level eyeglass? Just I'm wondering about that.
This is available, commercially available.
So before one. Okay, this one. So like you have some picture in the screen. So commercially available one. Okay. So do you have any data from the satisfaction of the visual impairment people after using this one?
No, not yet. Yeah, I just collect the information.
Okay. Any question from? Okay, Dr. Waterly, please go ahead. Your question.
Yes, very interesting presentation, and I'm interested in the statistics for the aging society in Japan. I heard mentioned that you were also involved in prevention of diabetes. Is that correct?
Yes.
Yeah. I just wondered, because I'm very interested in prevention of some of the conditions associated with the aging society, diabetes being one of them. I just wondered if you had any use of technology for helping to reduce the prevention of things like diabetes through the use of technology for self-management. For example, lifestyle tracking technologies. I use a Jawbone app, and I use other devices similar to the ones that you've shown in your project for measuring blood pressure. I have a wireless weigh scale, and I've used these very successfully to help prevent diabetes in my case. I just wondered if you had any programs in Japan, and if you are interested in working with me when I relocate to Malaysia on a program for diabetes prevention.
Okay. Today I just showed about the attached case sensor set in Bangladesh, but I also have the sensor network project in Japan, maybe from 4 years ago, 4 or 5 years ago, and I placed the sensor set and sensor network system at the home of diabetes patients, and they use these sensors. Immediately we can get the data to the database center, and from this data the computer system automatically make the recommendation to patients. For example, if the patient use elevator or escalator, the computer recommend next time use stairs instead of the elevator, like this. And actually, after this study, the diabetic patients improved their healthy status. Okay, and for the Bangladesh study, I also didn't show you about the results of this Bangladesh project. We also use the sensor network for about 20,000 people, and we provide telemedicine for 5,000 people among this. And these people improved their diabetes and hypertension by this sensor network with telemedicine service.
That's very interesting. Thank you very much. I will like to follow up with that later on. I'm at the moment working with Leicester Diabetes Centre on a project in the UK involving a sensor network. So maybe we can collaborate in the future on projects like this.
Okay, thank you very much.
Okay, thank you very much. Is there any questions? Okay, Seoul National University Hospital.
I am engineer in Seoul National University Bundang Hospital. Also, I am Professor YoungSung Lee student. So I usually studying healthcare or telemedicine. Yes. So thank you for your presentation. It's pretty impressive. And then I am interested about OR-CAM. I already watched some Korean movie for OR-CAM. It's like it looks like Google Glass, but it's different from functions. I think it's a scanner. Scanning. It's like a camera. Scanning anything and then save data, and then later it detect realization, some realization everything, and then it help people. It's right. My English is poor, but do you understand my thing?
Actually, this is very similar to Google Glass, as you say. But I didn't want to present all of the Google devices, so I want to introduce this one. Maybe, but this also really good device. But Google Glass is really progressive product, right? So we want to compare the two device function. I think this is a good answer for you.
Yeah. Okay. Thank you very much.
Okay. Thank you.
Okay. Okay. Thank you. Do you have any questions? Please raise your hand. I cannot hear. Okay. Thank you. Thank you, Nakashima, again for your excellent presentations. Thank you. We will move next speaker. Next speaker would be Sung-hee Ho. Sung-hee Ho is a chair of the Department of Rehabilitation Standard and Policy, Korea National Rehabilitation Research Institute. Her research interests at KNRRI include the development of rehabilitation programs, health promotion interventions for people with disabilities, and the development of functional assessment tools and patient classification systems. She is a member of the Health Committee of Rehabilitation International, Korea. Until 2008, she was a research assistant professor at the Department of Health Informatics, Graduate School of Public Health, Yonsei University, Republic of Korea. researching the knowledge-based system data mining application in healthcare. She is going to speak about the healthcare and the rehabilitation of people with disability. Dr. Seung-hyo, please go ahead. Seung-hyo, we cannot hear you. Please turn on your microphone. We cannot hear you. Okay, thank you. Thank you. Please go ahead.
Thank you for the kind introduction, Professor YoungSung Lee. It's my pleasure to be a member of today's meaningful meeting. So today, I would like to provide an overview of the health of people with disabilities. So, as you know, the health can be defined as a state of physical, mental, and social well-being, and the mere and absence of disease or infirmity. Article 25 of the Convention on the Rights of Persons with Disabilities by United Nations reinforces the right of persons with disabilities to attain the highest standard of health care without discrimination. The CRPD demands the following 4 areas for action, such as accessibility, affordability, availability, and quality in Article 25. So, according to the World Report on Disability by World Health Organization, across the world, many people with disabilities have lower levels of education, lower rates of employment, higher rates of poverty, unequal access to healthcare services, unmet healthcare needs than people without disabilities. The largest set of U.S. health data for people with disabilities, data 2010, measures health at the population level. Compared with people without disabilities, people with disabilities are more likely to experience difficulty or delays in getting health care they need, not have had an annual dental visit, not engage in fitness activities, use tobacco, be overweight or obese, high blood pressure, experience symptoms of psychological distress, receive less social emotional support. And how is the health of people with disabilities? I would like to provide a general overview of the health status of people with disabilities by looking at the different types of health conditions. Increasing evidence suggests that as a group, people with disabilities experience poorer levels of health than the general population. Disability is associated with a diverse range of primary health conditions. A primary health condition is the possible starting point for impairments on activity limitations or participation restrictions. It can lead to a wide range of impairments, including mobility, sensory, mental, and communication impairments. Examples of primary health conditions include ischemic heart disease, cerebral palsy, arthritis, etc. And people with disabilities have the risk of developing secondary conditions and comorbid conditions. A secondary condition is an additional condition that presupposes the existence of a primary condition. It can reduce the functioning, lower the quality of life, increase healthcare costs, and lead to premature mortality. But many such conditions are preventable and can be anticipated from primary health conditions. Examples include depression, pressure ulcers, urinary tract infections, and osteoporosis. And comorbid condition is an additional condition independent of and unrelated to the primary condition. It is the same problem that affects the general population. The detection and treatment of comorbid conditions are often not well managed for people with disabilities and can later an adverse effect on their health. Examples of comorbid conditions include influenza, pneumonia, cancer, hypertension, and diabetes. And people with disabilities are greater vulnerability to age-related conditions than those without disabilities. The aging process for some groups of people with disabilities begins earlier than usual. The aging process and associated changes may have a greater impact on people with disabilities. And according to the surveillance data from many countries, the increased rates of health risk behaviors are reported. Many people with disabilities are engaged in poor health-related behaviors such as smoking, alcohol consumption, drug use, and a lack of exercise. And people with disabilities are at greater risk of being exposed to violence than those without disabilities. Violence is linked to health outcomes including injuries, physical and mental health problems, substance abuse, and death. And people with disabilities are at higher risk of non-fatal unintentional injuries from road traffic crashes, runs, falls, and accidents related to assistive devices. Compared with people without disabilities, people with disabilities are more likely to have an increased risk of premature death and a lower life expectancy. And these unmet needs exist across the spectrum of health services, promotion, prevention, and treatment. Misconceptions about the health of people with disabilities have led to assumptions that people with disabilities do not require access to health promotion and disease prevention. But evidence shows that health promotion interventions, such as physical activities, are beneficial for people with disabilities. But health promotion activities seldom target on people with disabilities, and many experience multiple barriers to participation. So people with disabilities are generally less likely to receive screening and preventive services. For example, several studies found that women with disabilities receive less screening for breast and cervical cancer compared with women without disabilities. Adolescents and adults with disabilities are more likely to be excluded from sex education programs, family planning, and maternal health care. The oral health care of many people with disabilities is poor, and the access to dental care is limited. Mental health care services are also needed, but many people with mental health care conditions do not get them. Sorry. disabilities need the following two types of services. People with disabilities require health services for general health care needs like the rest of the population. General health care needs include health promotion, preventive care, such as immunization, treatment of acute and chronic illness, and appropriate referral for more specialized needs where they're required. On the other hand, some people with disabilities may have a greater need for specialist health care than general population. Specialist health care needs may be associated with primary, secondary, and comorbid healthcare conditions. Some people with disabilities may have multiple health conditions, and some health conditions may involve the multiple body functions and structures. Assessment and treatment in these instances can be quite complex, and therefore many necessitate the knowledge and skills of specialists. Now that I've covered the health status and needs of people with disabilities, why don't we move on the next phase? How can health systems address the health inequalities experienced by people with disabilities? Governments can improve health outcomes for people with disabilities by improving access to quality, affordable healthcare services. So I would like to suggest the following. The first one is on reforming policy and legislation. There are international, regional, and national levels on reforming policy and legislation. We need to establish healthcare standards related to care of persons with disabilities and frameworks and enforcement mechanisms. I introduced the Convention on the Rights of Persons with Disabilities as an international agreement, and I would like to introduce the Health People in the United States and the Health Plan in Korea as a national agreements. Health People is a set of goals and objectives with 10-year targets designed to guide national health promotion and disease prevention efforts to improve the health of people in the United States. And it is released by the U.S. Department of Health and Human Services each decade. You can see the graphic model in Health People 2020 on the screens. A society in which all people live long, health lives in the vision of Health People 2020, and this model represents the overarching goals of Health People 2020 and the determinant of health. Health People 2020 includes a small set of high-priority health issues that represent significant threats to the public health, and disability and health is one of these topic areas. Its goal is to promote the health and well-being of people with disabilities, and the disability and health objectives highlights areas for improvement and opportunities for people with disabilities. This slide shows the objective short title of Disability and Health section. As you can see, this section of Health People 2020 focuses on promoting the health and well-being of people with disabilities. Maybe you want to know about the national policy for health of people with disabilities in Korea. Now I'm going to talk about national policies for the health of people with disabilities in Korea. As you can see from the table, the Health Plan 2020 in Korea includes health for the people with disabilities for the first time. There are 7 categories, such as production of health statistics of people with disabilities, reinforcement of disability prevention, and health for disabled people section. In addition, one of the national projects in the President Park Geun-hye's government is concerned with the enhancement of the health of people with disabilities and the distribution of health promotion programs for the rights of them. And how can health systems improve health outcomes for people with disabilities besides reforming policy and legislation? Second, the governments can remove barriers to financing and affordability. It is needed to provide affordable health insurance and financial incentives for health providers to promote access and to reduce out-of-pocket payments to improve access. The third one is to address to barriers to service deliveries. We need to include people with disabilities in general healthcare services, improve access to specialist health service, and and promote community-based rehabilitation and use target interventions and information technologies. First, we should do something about to address human resource barriers. We need to integrate disability education into undergraduate training, support healthcare workers with adequate resources, and provide healthcare workers with continuing education. And the rest one is about data and research. Evidence leads to better decisions and better health outcomes. Data and research are critical for providing information to help understand the factors that determine health status and develop policy to guide the implementation and monitor healthcare services for people with disabilities. A lack of data and research evidence can create a significant barrier for policymakers and decision makers. So the Korean government started a health management research project for people with disabilities from 2012. This slide shows, this picture shows an overview of the health management research project for people with disabilities in Korea. The Korean National Rehabilitation Center is performing this task. The first part one is the project in developing disability monitoring systems. The second part is the analysis of risk factors of health conditions of people with disabilities. The last one is developing health promotion programs for people with disabilities. For the construction for health monitoring system of people with disabilities, we developed an indicator set. Through these indicators, the health conditions of disabled people can be assessed. They can be compared with non-disabled people, and health-related disability policies can be established. And this table shows the construction of indicator set for health monitoring of people with disabilities. There are 4 constructions such as health risk behaviors, secondary and comorbid conditions, and they are following indicators such as the rate of tobacco control and the degree of physical activities. Now we are conducting a survey using these indicators. And we are establishing the Health Information Center for people with disabilities to make more informed decisions. And we are analyzing the multiple risk factors for health conditions of people with disabilities by statistical methods and data mining techniques. And we intend to evaluate the combined patterns of risk factors. And we are currently developing the health promotion programs according to the types of disabilities. We have run a weight management program for people with physical disabilities as a starting point of developing the health promotion program. In the weight management program, we educated 700 people with physical disabilities to improve self-management skills and health lifestyle by properly managing body weights. And the program consists of physical activities and nutrition management and behavior modification and stress management. And we also published a weight management program book to provide information on how to manage weight for community-dwelling people with physical disabilities and provide strategies and efficient operation methods to be used in the other rehabilitation institutions. And I mentioned earlier, we are developing the health promotion program according to the type of disabilities. We also implemented the health promotion program for people with a stroke. The intervention method is similar to the weight management program, but the contents of the program were specified for stroke patients. Finally, I will conclude my talk with our future plans and suggestions. From the lessons we have learned, we identified the following recommendations for future projects. People with disabilities experience health disparities and greater unmet needs in comparison to the general population. So, improving the quality of life of people with disabilities requires not only preventive secondary other chronic conditions, but also that the interventions be expanded to incorporate to the promotion of opportunity. And preventive interventions and policies must be tailored to the specific needs of different groups of people with disabilities in order to be acceptable and effective. These interventions must be incorporated into clinical practice and population-based community health promotion efforts. And improving access to health promotion and disease prevention program for people with disabilities should be a national public health priority. And most of all, people with disabilities and clinicians and researchers should add their voices to the Health Plan 2020 process. That's all. Thank you.
Thank you very much, Dr. Sung Ho. I can ask just one question from the side because we are behind the schedule. Are there any questions? Okay, so thank you, Sung Ho, again. And The next speaker would be Dr. David Watley from UK. Dr. David Watley is the founder and the CEO of GATE. GATE stands for Gamification and Immersive Technologies Strategic Solutions. He is a visionary consultant on the strategic use of gamification and immersive and enabling technologies such as serious games, virtual worlds, and social networks. Throughout his career in converging and emerging technologies, David has been a pioneer and a thought leader in the application of these technologies for the development of a business and the society. He was appointed as the founding director of the Serious Games Institute at Coventry University in 2006, and he successfully established the Serious Games Institute as a global brand and a thought leader within 4 years. Throughout his career, he has been an innovative early adopter and user of disruptive technologies. His pioneering work has helped business, communities, and individuals leverage the power of these technologies for competitive advantage and business personal development. This work has been recognized through his fellowship of the Royal Society of Arts and Commerce and his appointment as an expert advisor on serious games and augmented reality for the EU's Vision 2020 strategic document prepared by the ICT Directorate, his role within the EU's project, and his regular invitation to deliver keynote presentations at international conferences. David is a respected and sought-after international conference speaker and writer for global publications on learning technologies, defense and health applications. He has written numerous papers on technology and society and is a regular conference presenter. So his long bio tells us what has been done so far. Today, he is going to talk about the gamification and enabling technologies for independent living. David, Dr. Watley, please go ahead.
Okay, thank you very much for the opportunity to speak to you. It's very early in the morning here in the UK, and I wanted to share some of my experiences with you. The theme of my presentation is slightly different to the previous presentations. I want to talk about the empowering ability of technologies to help disabled people, and there is no better person I can think of in the world to help me with this presentation than Simon Stevens, who is a remarkable young man who is going to tell his own story. So I would like to go through my slides quite quickly to allow Simon to tell his story. In fact, Simon is going to be using one of the technologies that was described in the first presentation we had this morning. He's going to be using a text-to-speech converter to deliver the audio for his presentation because his condition leaves him with a speech impairment, which makes him a little bit difficult to understand unless you know Simon. So I'll get straight on with it. My structure of the presentation, I'm going to talk a little bit about enabling technologies and what I mean by those, and give you a little bit of background to how I came to know Simon and some of the projects that we've been involved in together. I'm going to hand over to Simon and then finish at the end with some conclusions. And when we have questions and answers, it would be helpful if you could open up your group chat so that we can use text as well to communicate to each other. A point I want to make is that all of us, from the time we are born, we are genetically programmed to try to make the best of the world around us, but we are all constrained by our physical and mental limitations. We can only walk or run so quickly, we can only lift so much in weight, and our mental abilities are also limited. So from the beginning of time, we have been differentiated ourselves from the animal world because we have had the ability to be able to innovate and develop inventions which empower us with extra strength and speed, whether it's things like the invention of the wheel or the ability to use technology to lift very heavy weights and construct things by collaborating with each other. So it's very much a physical and use of technology to both empower ourselves physically and mentally. So over the centuries that mankind's existed, we have developed many kinds of technologies to leverage our capabilities as individuals, from very early script writing to the Roman roads, which helped to develop their civilization, the invention of the printing press, which allowed us to share ideas with the rest of the world, to communications technologies like canals and railways, radio, cinema, television, and the technology we're using today, which makes it possible for me, sat in my living room in the UK, to be able to share my ideas with people in Korea and Japan, and potentially later on all over the world. So whether we are physically described as physically able or not, or disabled, we all of us in some way or other use technology to overcome our limitations. So we invent devices and machines that help us to overcome these difficulties, particularly if we have problems with hearing, eyesight and mobility. So this sets the scene to my talking about Simon Stevens, whom I first met almost 14 years ago. I was involved in a community technology project, and as part of that project I ran a series of initiatives, and in fact in a very similar way to we are using technology for a webinar today, back in 2002 I ran a combined webinar as part of a radio broadcast program, and every morning I would do a radio breakfast chat show, and I would invite guests to show or talk about how they were using technology to empower their lives, and every day had a different theme. And one of the days was on the use of ICT for disabilities. The way it worked was that we had a webinar exactly like this, except we weren't using video. We were just using presentation slides and audio, and as well as it being broadcast over the internet so that people could see slide presentations and hear the audio, it was also broadcast over local radio. And to set up this program, I used the internet to find people for my program, and Simon was one of the people who received my newsletter, and we communicated via email. I invited people to send me their presentations and their ideas, and Simon submitted an excellent PowerPoint presentation. And I should stress at this point, I had not met Simon, so I had never communicated with him by anything other than email. So I did not know, I knew he had cerebral palsy, but I did not know he had a speech impairment. So I invited Simon to present on my radio broadcast, and when the time came, Simon connected by telephone for his audio, and he loaded his presentation slides upon the screen and began his presentation. And it was only when Simon first spoke that I realized that he had a speech impairment, which made it very difficult for me to understand what he was saying and for people who were listening. However, the superb lesson that I learned from Simon's presentation was that his slides said everything for him. So his speech impairment really made no difference to the way he communicated. He was able to explain his ideas very clearly through his slide presentation. And I realized that Simon was a very intelligent young man. And in fact, he was more knowledgeable about the use of technology generally than I was. And one of the reasons for this was because that Simon had a need to use technology to overcome some of the problems associated with his disability. So I developed, that was a started relationship with Simon. We continued to communicate, and some years later, when I began to work at De Montfort University, I was sending out a newsletter, and in one of the newsletters I mentioned a new virtual world called Second Life. And Simon, being his usual very inquisitive and entrepreneurial self, went into Second Life, and he made some remarkable use of Second Life, which he's going to tell you about, that transformed his life and also the lives of many other people. And I should stress that despite some of the problems and disabilities, impairments that Simon has, he has had a bigger influence on the lives of many people around the world than I have, because he has been able to inspire and encourage other people to be able to use these technologies. The final thing that I want to mention was that when I became director of the Serious Games Institute, I had no hesitation in inviting Simon to be a member of our project team. And there was one occasion when we had a project meeting where not just Simon, but several other members of the team could not attend physically because they were in other places or they were doing other things. So for that meeting, we decided to hold the meeting in the Second Life virtual world. We had our own virtual boardroom. You can see a picture of this on the screen. And all of the participants were not physically in the same place. We all logged on to this virtual world, and we conducted our meeting in Second Life. And because of Simon's speech impairment, we made a rule that as chairman of the meeting, I was the only person allowed to use audio. Everyone else typed in what they had to say into text chat. You can see Simon is the person in the white shirt in the boardroom, and I have to say this was one of the most productive project meetings I've ever been to, because apart from the fact we finished everything on time, it also meant that we had a complete record of our dialogue through the text chat area. This provided us with an automatic set of minutes for the meeting. So it was a fabulous example of enabling technologies. So that's enough from me. I'd like now to hand over to Simon, who's going to show you his slide presentation, and he's going to be using text speech to chat to deliver his audio. So Simon, would you like to go ahead with your presentation now, please?
Yeah.
It is no understatement to suggest that without the technology we enjoy today, my quality of life as well as my presence in the world would be severely compromised, leaving me with little ability to make a meaningful contribution to my community and society. Throughout my life, I have been a sponge to new technology, soaking up its potential as someone ready to enhance it to see how it can further develop my goal of making a difference to other disabled people. explore with me how the history of personal computing is intertwined with my own personal journey, as both technology and myself have grown and developed in the last 40 years. I was born in 1974, and due to complications with my birth, it left me with cerebral palsy. This has meant that I am unable to write using a pen and have a speech impairment, mobility difficulties, and so on. Since I have not known anything different than being impaired, I never saw why my difficulties would stop me achieving what I wanted as I grew up and embarked on my career. When I started secondary school in 1985, a mainstream school, being unable to write was a big deal. There were home computers with an average memory of just 16K, that's a billionth of the memory of my current iPhone, and word processing was in its infancy. I was given an Epson HX20, which I only discovered recently was the world's first laptop. It had a built-in printer and printed using till-receipt paper. As new technology came on the market, I was eager to try it, and over the years I have progressed through numerous portable and desktop computers. Each new device was not just a new toy, but also a new opportunity to make my life easier and open up new opportunities to do more. I always took the time to explore all the features of new devices and software in ways few people do, to really take full advantage of what can be achieved. The biggest breakthrough and probably the world's greatest invention was the Internet. The Internet radically changed what is meant by community, providing me with a voice in a way that was seemingly impossible before. Today is a perfect example. Without the Internet, it would be unimaginable for me to present at a conference in Korea while sitting at home in Coventry, UK. But the Internet is not just about communicating and exchanging information. It is also about intercultural learning on a huge scale. The Internet has enabled me to grow as a person, to express myself as a person, and use my strengths and reduce my weaknesses. Second Life is a virtual world that played an important part in my personal development and gave me an opportunity to shine with the creation of my virtual nightclub, WeLies, which launched in 2006. It is something that needs to be seen to be believed, but it is basically a disability-themed music venue where people from all over the world can come and virtually dance using their avatars. An avatar in itself has been an important way for people to express themselves. While many people have chosen Second Life to escape from the realities of real life and reflected this by making their avatar very different to their real selves, I was the first person to have an avatar that used a wheelchair. My logic was that I did not have time to be anyone but myself, and I am proud about who I am, and did not want my impairment to be invisible, since it is not invisible in real life. While this was a natural and automatic decision for me, I was overwhelmed at the media and academic attention around the world my decision caused, as it significantly challenged people's perceptions of disability. I think technology, particularly the Internet, has been the single biggest piece of technology that has changed my life. Actually, it has made my life. Without the Internet, I would be lost. I know everyone here would say the same, but for me, it is so true, as I am unlikely to survive any post-horrific world as so many science fiction films predict. I am always excited about the future of technology because of the opportunities it could provide me. I think the improved interconnection of devices and things like smartwatches will make environmental control easier, where I can control my washing machine and other devices from my iPad or Mac, offering me that extra bit of independence from the personal assistants I employ to assist me. Technology makes me less disabled and has enabled me to compete on an equal basis with my peers, and I am very grateful for that. I am happy to answer any questions you may have if we have any time. Please also feel free to look at my website or follow me on Twitter.
Thank you.
Okay.
Thank you for...
Thank you very much for that, Simon. I'm now coming back to my slideshow just to finish off this presentation and invite questions. So I think you will see that Simon has made excellent use of technology himself, but not just in today's presentation, but he has made excellent use of technology throughout his life in fact, to achieve far more than many able-bodied people would be able to achieve. So I would like to conclude by making a few observations, really. Every one of us uses enabling technologies within our lives to help us to achieve more than we could do as an individual by our own power, and help us to shape the world around us and have an impact on not only our own life but the lives of others. And so our ability as human beings to innovate and our motivation to fulfill our potential is vital. And Simon possesses both of these in very full measure. He's a wonderful entrepreneur and innovator, and as he runs his own consultancy business for people with disabilities, and I am certain that he would welcome collaborating people with Japan and Korea and all over the world to share his expertise. And because he's got very first-hand personal knowledge of some of the problems of disabilities, he's an excellent person to provide some advice on what technology is available and what it can do for people in the same situation. And also, I think it's very important to recognize that some of the problems that we've heard about in earlier presentations arise because people make judgments about those who are disabled. And as you'll see from Simon's presentation, just because people have a physical or a vocal impairment doesn't mean that they are not intelligent and that they are not able to achieve great things. Simon has a fantastic number of followers on Twitter. It's over 5,000 now, and he's a very well respected international figure who's spoken at various conferences and whose work's been recognized throughout the whole world. So both of us would be delighted to answer any questions that you may have, and all I would ask is that you use the text chat area if you do have any questions. So I'll now stop sharing my presentation and invite any questions that you might have.
Okay,
for me or Simon.
Okay. Do you have any questions? No.
So, may I
Okay.
direct a question to Dr. Wiltley?
Yes.
Okay.
Yeah. Your presentation was very interesting to me. So, do you have any experience of measurement of the satisfaction or effectiveness of the system you applied?
I don't have any statistics, but I am about to embark. I'm about to transfer to Malaysia to set up a new institute at the University of Malaysia. What I have done, and this will be the basis of a major health initiative I want to launch, is I have used myself as a kind of guinea pig for the use of sensor technologies, in my case, to overcome obesity and pre-diabetes condition. And I'm looking to launch a major initiative next month which will involve collaboration with health professionals, but also people within industry. And it's based on my experience of the use of sensor technologies to improve my own situation. What I use, I'm just showing it on my wrist now, I use a lifestyle tracking device called a Jawbone Up, which measures my physical activity, and it connects to an iPad application, which I'm trying to show you now on the screen. I don't know whether you can see that, but this application measures my physical activity, it measures my sleep, and it also measures the nutritional value of the food that I eat. So over the last year, I've been using technology to manage my own health. I managed to lose 21 kilos in weight, and my blood test results have improved remarkably. And what I'm looking to do is to work with people in Asia to use sensor technology to help people to go through the same experience that I've had and to examine the result. We've already heard that from the presenter in Japan about program in Bangladesh, and I would like to set up something similar, but to use technology and gamification strategies to help people use technology to better manage their own health and their own lifestyle. At the moment, I don't have any statistics, but this is the reason why I want to set up a major trial, because I think if the results that I've achieved for myself can be replicated for thousands of people, it will represent not only an incredibly improved quality of life for those involved in the project, but also reduce costs to the healthcare system and ways of tackling some of the problems associated with the aging society.
Thank you.
Any other questions for myself or Simon?
If any questions, please raise your hand.
Okay, so somebody's got a question for Simon. So Simon will use the text chat to respond to that question, which says that given his experiences, could he provide a few examples of the advancement of IT benefits? So whilst Simon is responding to that in the text chat area, I would just like to just share one experience where there has been advancement in IT, which has actually been a disadvantage to Simon, and that is in the Second Life virtual world, because when Second Life was first introduced, it was very empowering, but it had no voice over IP or audio capabilities. So when Simon was setting up his nightclub and everyone was using text chat, it was a level playing field for everyone. But when audio came into it and people communicated via audio, this meant that Simon again was placed at a disadvantage, because of his speech impairment, it was more difficult for him to communicate via audio. So IT can be very empowering, but it can also inadvertently sometimes add to the problem. So I will leave Simon to type in his own reply.
Okay. Are there any questions? So some chattings.
Any other
on there.
questions for me or Simon?
We have some chattings on there.
Yeah, Simon has typed in a reply now. For those of you who don't have group chat, so what Simon's saying is that the technologies that have advanced in his lifetime has helped him with banking, online shopping. He can buy his food online. He uses email that allows him to work from home. And as you'll see I've seen from Simon's presentation, his text to audio to supplement his presentation slides was also very empowering.
Okay. Okay, so are there any questions? Okay, I have a
well. I would just like to thank you all for the opportunity to be able to share our experiences with you, and I very much hope that we can continue our collaboration and also involve Simon in some of our work, because he, through his personal experience, has a lot of value and knowledge to be able to share with you all. And I look forward to coming out to join you in Asia, hopefully in September, and to collaborate with you on important projects which can make a difference to the health of everyone in the world.
Okay, so thank you, David Waterley. So I really remember your presentation on this June activity, or May, so at the temple stage. So why don't we have some Asia or global network for the some forum on this kind of activity on disability ICT forum. So if you have any plan to make that kind of forum, so I really would like to join, and maybe Korea National Rehabilitation Center will join this kind of activity by regular meetings. So what do you think about that?
I think it's a very good idea, and I would be very interested in working with you, and I'm sure Simon would also be interested in being part of that, because it is a passion that we share to try and use technology to improve the lives of as many people as possible. There are the main directions and the main focus of that are first of all to find ways of sharing knowledge about how to help people with impairments and disabilities, and secondly also on the health maintenance and prevention area, particularly with some very important things like diabetes, obesity, and lifestyle related problems.
Okay, so I would like to conclude this session. So today's session was the synergetic effect of ICT in solving the difficulties of people with disabilities. So today this healthcare session has been persistently explored how we can collaborate in solving healthcare issues by adopting new information technologies. So far, today's session is really impressive for me and for our people. So I really think this ICT can help or can support our societies, and so we can make some difference from using this kind of activities. And also, I thank you all, the staff and the speakers, for your valuable presentation, and a special thanks to Simon Stevens for your being here and telling about your personal journey to us, our group. Thank you again. Goodbye. So see you, if you have opportunity, see you next APA meeting. Next APA meeting will be held in Fukuoka, Japan. So please keep in touch with us, and thank you again. Goodbye.
Thank you very much, and goodbye. I'm going back to bed now.
Okay.